The global investors meet organized by the Tamil Nadu government in Chennai has brought to light several innovations, particularly by the startup community across Tamil Nadu. With me, Sairam, an IIT Madras alumnus, who has designed a very fascinating handheld device which does the work of a stethoscope. It can also measure the levels of sugar, BP, ECG, oxygen, besides temperature. How does it work?
So it's a multi-vitals monitoring device. It's got multiple parameters. Like you mentioned, it's got a digital stethoscope to measure the heart and lung sounds, infrared thermometer to measure the body temperature, pulse oximeter for oxygen saturation pressure, and blood pressure monitoring, blood glucose through a strip, and 12-channel ECG also. So this gives a complete package of all the vitals which is required for any analysis. And the advantage is this is connected through Bluetooth. So we have
This is to be used remotely, not by the doctor himself or herself.
This is not for it's not for doctors. The idea is that we are empowering community workers to be able to do it at the doorsteps of people, especially in the rural outreach. And the vitals which are measured then can be transferred to the doctor, who can then take informed decisions more than what they can actually do.
So this is called ASHA, and this will be used probably by a nurse or any healthcare worker remotely.
Remotely, yes. So, so typical implementation is like an ASHA worker. If you take the rural scenario, there's something called ASHA workers who are from the village, and they can actually go door to door and take the measurements. And
following the COVID, already tele-consultation has become very popular. What does this offer that the present system doesn't offer?
So the idea is the teleconsultation is the doctor can talk to the patient, but the doctor also needs the important vitals information for him to take informed decisions. Right. So these vitals can be captured, and they are not subjective. So these are objective measurements that are happening, and it is irrespective of the worker who is doing it. So the doctor can get the same amount of information that he himself would be personally looking at. So that helps him to make a good decision, and obviously the quality of life, quality of care for the person at the remote can also be improved.
So can you show us how does it work?
Yeah, so this is simple. So for example, the temperature, you just click on this, and you can just scan the forehead, and you get the temperature output here. Similarly, for the pulse oximeter, you click it, and you can take the measurement here. It takes 30 seconds for the measurement to come. Blood pressure is through a cuff. We connect, and it can automatically inflate and deflate the measurements. The ECG, we provide a chest belt. So it like typically the ECG, there needs to be trained technicians to put the leads. But here it's a belt that they can just strap on and take the measurement. And then there's a stethoscope. So what, in addition to what parameters, the digital stethoscope is an important aspect because both the heart and lung sounds can be captured. Yeah. So this is the digital stethoscope which we talked about. So it can actually capture the heart and lung sounds. So in aspect to other aspects of the measurements, even the heart and lung sounds can be looked at by the doctor.
Listen, the doctor's job outsourced?
No, actually it enhances the doctor's reach actually. So a lot of patients are not going to the doctors at very early stages. They go much later when they're more critical. This allows them to be treated much earlier, and it's a more preventive care that can happen.
Thank you. We also have Shanta Kumar, who mentored the startup team. Thank you very much. And in the long run, what kind of a change will this innovation bring about?
Yeah, I think it's a really excellent tool for doctors to have, not for themselves, but for someone who's not a clinician, to actually use the device and transmit the data to him, because this is a screening tool. And once the screening tool gives the physiological data, it makes the job of the doctor much easier. So they can actually evaluate the patient even before they see the patient. And then once they have all the data, then it's much easier for them to do the evaluation and quicker. So the doctor's time is actually more optimized.
Healthcare-wise?
Healthcare-wise, yes. So where there is currently no access, this is an excellent tool because it's a small handheld device which can be transported anywhere. And even during the COVID time, a small device like this could be left in the doorstep of a patient, and then they could have taken all the vitals, and then that vitals transmitted to the doctor. And so it makes the access for a device like this to the patient much better. Besides that, I think the other opportunity that is there is also in crowded doctor's office, where the doctor need not be checking so many different parameters. but even the person in the reception or somebody else could actually take these results and then have the results ready. When the doctor sees the patient, he will have all the data with him. Right. So he can make a very informed decision.
Tell us about the kind of impact this innovation, according to you, has made so far.
Yeah, we have done major implementation in Andhra Pradesh, Jharkhand, Uttar Pradesh, and in the northeast in Mizoram. Beyond that, we are also doing trials in Assam and Madhya Pradesh and Maharashtra as well. And it is majorly for the non-communicable diseases. So we are able to reach at least 40 lakh people, and we have been able to screen them at the doorsteps.
As a startup, tell us about the funding, tell us about the kind of investments you've been able to generate or bring about.
I should first thank the MyGov initiative for having identified that entrepreneurial spirit is very important for a country like India. And we were, I should say, the few 1,500 I think our number of the startups then itself in 2015 when we got our registration. Now the number of startups is almost 1 lakh in the country.
How much have you raised?
The seed funding was 20 lakhs from CIIE, but the project funding that we got from the State Bank was 1 crore 50 lakhs.
So it's bootstrapped completely?
Yes, completely bootstrapped.
Any projections?
The projections is right now a turnover of the company could be just 1 or 2 crores, but the device could actually be implemented in almost 1 lakh health and wellness centers all over the country, and that could mean easily a 400 crore project. So a startup can implement that level of a project because we have been given the right impetus at different stages of our growth.
Thank you very much for your time and a very fascinating innovation in healthcare coming from Chennai. At the Global Investors Meet in Chennai with Suresh, Sam Daniel, Find TV.